I'm Sophie Scott. Welcome to Health Watch. For some smokers, it takes a heart attack to finally kick the habit. So cardiologists at Sydney's Royal North Shore Hospital have come up with a novel way of helping people quit before they get to that point. Hank Davis smoked for 40 years and was starting to have symptoms like shortness of breath, but quitting proved hard.
Oh, I must have given up 3 or 4 times like a lot of people I know. Just didn't work.
Smoking doubles your risk of a heart attack. Most people who end up having an attack kick the habit.
Our aim was to see if we could help relatively healthy people, relatively healthy smokers without heart disease, to motivate them to stop smoking by using a personalised video.
Patients watch themselves and their family and what would happen if they had a heart attack.
It can happen when you least expect it.
Help somebody!
Watching the video had a profound effect. The 65-year-old gave up cold turkey.
And the most significant risk is that he will not pull through at all.
It's rather indicates what's going to happen if you just carry on. And you don't really want to lose your family, do you? And move on.
If he stops...
A pilot study of the videos found that more than half of the smokers quit after a week and kept off the cigarettes for 12 months.
When somebody watches a video on TV, they can avert their eyes and sort of say, well, this is not me. But in this case, it obviously is them.
Researchers want to recruit 200 people for a larger study and hope one day the technology could be rolled out to GPs. New research shows young women are increasingly shunning life-saving pap tests. Embarrassment and fear are said to be the main reasons, but it seems that the new cervical cancer vaccine may also be playing a role. Lucas Ellis lost his wife Melissa to cervical cancer when she was just 34.
With the testing rate still well down and where they should be for this insidious killer, I find myself continuing the battle of awareness and prevention of this hideous disease.
In a worrying development, the latest figures show more young women are not getting regular pap smears.
Nationally, one out of 2 younger girls are not having pap tests every 2 years. So that's 50% of these young girls not having regular screening. And that's a real concern to us.
Rates amongst young women have dropped by almost 10% over the last 10 years. Medical experts say the reasons are varied.
Potentially it's because a pap test is somewhat awkward and embarrassing. They find it difficult to find time for a pap test, which I think a lot of women can relate to.
But the new cervical cancer vaccine may also be a factor. While the vaccine targets 2 strains of the human papillomavirus, which can lead to cervical cancer, it doesn't prevent all cases of cervical cancer.
We would like to tell women that even if they've had access to the cervical cancer vaccine, a pap test every 2 years is still very important for them.
Older women are getting the message. Pap screening rates continue to rise. And researchers have linked a second type of mouse virus to the baffling condition known as chronic fatigue syndrome. Their findings don't prove that any virus causes the symptoms. The US researchers found the virus in more than 80% of chronic fatigue patients they tested, but less than 10% of healthy blood donors. That's all for Health Watch. See you next week.